The numbers on just how many people would lose their health coverage under the bill passed by the House of Representatives earlier this month. The nonpartisan Congressional Budget Office estimates that as many as 23 million people would be affected by 2026. The House bill to replace Obamacare would reduce the federal deficit by $119 billion over the coming decade. The CBO says insurance premiums would be lower, but the coverage would not be as robust. Harry Stein is the Director for Fiscal Policy at the Center for American Progress. Thanks for joining us, first off, and your reaction to these numbers.
Well, good to be on. You know, I think there's some things that are in here that was what we expected from the earlier CBO scores of the bill. 23 million people lose their health insurance, and the wealthiest people get big tax cuts. One of the most expensive provisions in the bill isn't to give health care to people. It's a tax cut for investment income that only applies if you make more than $200,000 or $250,000.
Yeah.
What's new in this score is how bad the bill is for pre-existing conditions. Those were the changes that they made to get the bill through the House. People with pre-existing conditions in a lot of states, we would see death spirals in the insurance market, which means that premiums would keep getting higher and higher for people that need more health coverage until they'd finally be priced out of the market entirely.
Yeah, and this seems to be the conversation that the Republicans who were pushing this, and I'm talking specifically about the House leadership, this is the narrative that they didn't want to talk about, you know, way back when. They didn't want to talk about the numbers that would lose the insurance. They didn't want to talk about pre-existing conditions. They talked about choices. This would give people the freedom. They talked about promises, campaign promises being fulfilled. How do you jive the two? How do you put the two arguments together?
You know, this maybe sounds a little bit harsh, but it really felt like it was a game to these people in the House when they were voting on this bill. They'd keep going back to their talking points as if just repealing the Affordable Care Act in and of itself was an end, without the goal of, well, what does this actually mean for the country? And so when you'd say, well, what about coverage? What about costs? What about people with pre-existing conditions? They'd wave it away and they rushed the bill through without knowing what it would do. Now we know what it does, and we see that the effects are, as we were concerned that they might be, quite catastrophic.
Yeah, and quite a few people who were watching this, you know, not necessarily partisan people, also were saying that this bill will not stand the test, any kind of test in the Senate. You agree with that?
Well, I think it'll remain to be seen. We have Republican control in the Senate, and they can pass it with a simple majority. We've heard several Republican senators say they're concerned, but just like in the House, we heard a lot of people say that they were concerned, and then they voted for it anyway. So I think we're going to need to see a lot of pressure on senators, particularly the senators in states where they might be electorally vulnerable. But I think it's up in the air whether something like this, or at least substantially similar to this, certainly could pass.
And a lot of people obviously are going to be waiting to see what the president has to say about this.
Absolutely right. You know, President Trump put out his budget recently, and that included all of the cuts that are in this bill. And you know, let's talk about campaign promises. President Trump said he wasn't going to cut Medicaid. This health care bill that the House passed makes over $800 billion in cuts to Medicaid over the first 10 years alone.
Okay, all right, we're just going to